Can we talk a little bit about advanced dementia? I've heard that phrase. Can you say a little bit about that stage of dementia?
Yeah, so advanced dementia really is, in my most layman terms, I'd say when anyone who meets them recognizes something is not right. They may not know exactly what that is, but they can literally look at someone and say, hmm, something's going on with them. And so, again, often they are not talking. They are not caring for themselves in any capacity. So there's no bathing, not able to put on clothes, often not able to walk.
Even difficulty eating? I with
Difficulty
my
eating. Yeah, I
aunt.
tell
Yeah.
people it's like they forget to eat. And so you do have to encourage them to eat, snack, graze, however you think about mealtime, because there isn't sort of that reminder to drink water or to eat, or it doesn't seem like it registers for them. Their personality is often completely gone. And so if you look at them, they often don't seem like they are able to. Sometimes they'll engage with you. You might get eye contact, but it doesn't really seem like that person is still there. And so with advanced dementia, it's figuring out who can provide all of that care, because this person is still going to need to have their teeth brushed, and they're still going to need to be bathed and fed. And if they're in a bed, they're going to need to be turned every 2 hours or so, because then you can get bed sores if you're not turned consistently, or if they're in a wheelchair. And so how do you still care as we would consider a total care? How do you provide all of this care for them? And so oftentimes people will consider sending them, placing them in a long-term care facility. So a place where they can live, they're a resident there, they can receive 24-hour care. Sometimes people have paid sitters that stay with them, or paid help that assist the facility in doing that. But there are a lot of people that don't want to place a family member, a friend, someone they're supporting in one of those places. And so then you have to get creative, right? So do you have the finances to then bring someone in to help with day shift, afternoon shift, night shift? If you're working, are you quitting your job and then taking on one of those shifts? If you're retired, are you using your retirement time to do that? And so it really is, it's a huge decision that you cannot take lightly, and should have all of the options given to you. And so that is, for me, that is where social workers shine on the healthcare team. And talking about team members, social workers often know placement specialists. If you're considering placing someone in a long-term care facilities, these placement specialists sort of get an idea of what you're looking for and try to let you know what's available in your price range, in your geographic region. Social workers just know a lot about a lot when it comes to community resources. And so just recognizing that it is very challenging, it is difficult. The other thing is, if whether you were really close to this person or you didn't have a good relationship with this person, recognizing that their end of life is probably drawing near, and wanting to make sure that we hopefully have already got all those paperwork, the affairs are in order. But if not, what does that look like? What does a peaceful death, what does that look like for this person?
Very challenging conversation, but very important. And just talking about it, I think, allows people the space and the grace to have these conversations and make what is a very difficult time a little bit easier. So, thank you.
Thank you. I know we're probably ending this segment, but if I could add one more thing,
Always, Dr.
it is
Bonds-Johnson.
that caregivers have such a hard time with this, especially if the person they're caring for said, never place me in a facility. And the thing I would say to them, and the thing I do say to them, is when you have done all you can do, you can't do anymore. And so sometimes we have to go back on that promise. And I believe that they'll understand. If you are still working full time, you still need to work full time in order to care for them, to meet your needs, then it's okay if you have to amend that promise, if you even have to break that promise. I think it's okay. I think they'll understand, because in the end, you were trying to do what was best for them.
Thank you for that. And as I end, I will just say those who you work with are very lucky. So thank you.